Thank you for joining us. You are a part of a powerful group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 41 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Hello and welcome. My name is Christal Jordan and I am the editor-in-chief for Lennox and Parker, but I am honored today to be serving as your moderator for an amazing conversation titled, "We Are Not Broken, Our Health is Our Power." As you may know from that intro, this is a celebration of 41 years for the Black Women's Health Imperative. To celebrate that, there is an entire week of activities. This conversation is definitely going to be one of those. We started the week yesterday with Change Your Lifestyle, Change Your Life, and IG conversation hosted on administering wellness success stories. And then tonight, we're going to have this conversation again titled, "We Are Not Broken, Our Health is Our Power." On Wednesday, we are celebrating National Daughters Day with the Me Period advocacy and different screenings all over the country. And on Sunday in Atlanta, we are hosting There is Power in the Pause, reclaiming our power before, during, and after menopause. That being said, make sure that you check out BWHI.org so that you can get all the information on all the activities scheduled for the anniversary weekend. But tonight, we are excited to be welcoming members from BWHI. Now, I have had the opportunity to host many conversations with the organization, with other participants and health experts from across the country. But tonight, we felt like it was important to let our audience know that BWHI is composed of health experts on our staff, amongst our board, and with our president. And so tonight's conversation is going to be from internal experts that are actually a part of Black Women's Health Imperative. So with that said, I'm going to go ahead and bring up my esteemed panel. My first guest is Michele Tedder. She is an RN, and she is the Senior Program Manager for Black Women's Health Imperative. Welcome, Michele.
Thank you.
Our next guest is Dr. Zsanai Epps. She is the Senior Director for Reproductive Justice Initiatives and also Black Women's Health Imperative. Welcome, Zsanai.
Hi there.
Hello. We are going to next welcome Dr. Sharon Thompson. She's OBGYN and the Vice Chair for Black Women's Health Imperative.
Hi, everyone.
Next, we are going to welcome Dr. Barbara Brown. She is a clinical psychologist and a board chair for Black Women's Health Imperative.
Good evening. Nice to be here.
And last but certainly not least, we have our president, Linda Goler Blount. Of course, she is the president of Black Women's Health Imperative. Welcome, Dr. Blount.
Hi, Christal. It's great to be here.
Absolutely. Now, as I mentioned before, we have this health imperative, and all of you are members, and all of you are also involved in health for your career and have been for quite some time. And I'm wondering, from a personal and professional perspective, how does your work align with your personal goals and also your career goals? And if you ever thought at one point in your life that you would be doing this type of work to actually help Black women live healthier and more fulfilling lives? I'll start with you, Michele.
Oh, right out the gate. Well, I often joke and say that I preach the gospel of health, and I've been a nurse for a really long time. And so as I look over my career, I've always been very passionate about health and advocating that folks have equitable access to appropriate care depending on what they're dealing with. So honestly, I can't imagine doing anything else. And definitely being part of the Black Women's Health Imperative for the last 3 years now has just made everything come full circle, is that not only do I get to work on my passion, but I also get to do it as a Black woman for Black women. And that's just absolutely amazing. And I can say, and I'm not just saying this because our CEO's on, but I really do wake up every day thinking that I get to do this and that it's not a chore. So.
What about you, Dr. Zsanai? How do your career goals and your personal goals align in the work that you do?
Yes, so I've always known that I wanted to help people, right? Be in the community, do the work. I thought I was going to be a medical doctor, but things, shaped up differently. But I knew that something was wrong. I knew that a lot of women in my family died before their time in their 40s and 50s from preventable chronic conditions. I knew that my community where I grew up, we were disproportionately impacted by a lot of social issues. And so I knew I wanted to go to school to do something, right? And so that led me to my professional career to be of support and to be that resource. And so working for an organization that not only pours into me personally, but then also expands me professionally is so important. All of what we do here at the Black Women's Health Imperative is, it's collective work, right? We do it for the larger collective of Black women, but we also do it for ourselves because we have to start with ourselves first in doing this work. And so that's what really brought me to this work and connects me both personally and professionally, because I've grown up with the organization. People always hear me say that often. I really did grow up with the Black Women's Imperative.
That is beautiful. I think it's beautiful when you're able to realize your purpose in the work that you do. You mentioned initially wanting to be a medical doctor, and we know that Dr. Thompson is an OBGYN. And so I can only imagine how your work overlaps so much with what you're doing, in your career and the work that you do with BWHI. Can you talk a little bit about that motivation and how those two parallel in your everyday life?
Like Zsanai, I always wanted to be a doctor. In fact, when I was about 10 or 11, I decided I was going to be an obstetrician gynecologist, not just a doctor. And thankfully, it is as amazing as I thought it was going to be when I was 11. One thing I could not have imagined when I was 11, when I was an 11-year-old Black girl in Brooklyn, is the disparities that we see in healthcare. I had no idea about those, but I am privileged to be able to work on improving healthcare for Black women and for the nation. I want to tell my BWHI story quickly. When I was 20, before I even went to medical school, I moved to Los Angeles and I was looking for Black women. And like Zsanai said, I was starting with my own health. So I looked up and found the Black Women's Health Project at the time, went to their conference in 1990 and was just awed at the information and the strong, powerful women and the focus on self-care and information. And now here I am, like Zsanai said, full circle, vice chair of the board of the Black Women's Health Imperative. And I could not be more thrilled to be doing the work that I do in my office, but then this work here with this group.
All right. Well, that brings me to Dr. Brown as a clinical psychologist again. I believe it's probably been the last 10 to 15 years, we've really been talking about mental health,
Right.
In addition to physical health. For so long, specifically the Black community was not having these type of conversations that we've been having even more so as of late. And so can you tell us how your work as a clinical psychologist and being, a chair for BWHI, how do those roads connect in your everyday life?
Sure. I guess, I kind of knew that I was going to do healthcare. I grew up in a family where there were care providers as well as civil rights activists. And so I was taught from an early age, you get your education for what you can do for the community. And so when I discovered my passion in psychology early on in high school, it was really wonderful. And so I see the blending of that career. I went straight through and got my degree in psychology and really always had a focus on giving back to the community. So that it just really always felt like my purpose, my calling. And so the Black Women's Health Imperative has two things that really are very attractive. One is about the health equity aspect, as being a clinical and community psychologist, have a very large practice with about 80 therapists, and we are really focused on the mission of providing affordable and accessible mental health care in the community for all ages. But the Black Women's Health Imperative, again, health equity for Black women, and also the fact that they recognize mental health in all of the work that they're doing. They understand the mind-body connection very well. Yeah.
Linda, I'm going to ask you, because you've been leading this amazing group of women that are doing just work across the country. You know, I'm based here in Atlanta, so I get a firsthand view of what is happening here. But the programs that BWHI participates in and coordinates affect women across the globe. And I just want to know from you, as president and leader of the organization, how did you see yourself? The road, I guess, from you growing up and the things that you were interested in, what led you to being a part of this organization and eventually leading this organization over the last few years?
Well, Christal, I think like Michele and Zsanai, I can't really imagine at this point doing anything else. Starting out, I was going to be an attorney, then I was going to be a biomedical engineer, and I actually did do engineering, but then I ended up in the for-profit world, which was great. But what I learned, and I happened to work for a fairly large organization that's in the soft drink business here in Atlanta. You might know it. What that organization does is sell experiences, not necessarily soft drinks, but just, what they sell is, you would look really great drinking this can of carbonated sugar water. And what I realized is, with my degree in epidemiology, that we in public health also have a product to sell, and we do a terrible job of selling it. And Christal, that people in the medical field and public health can make things much more complicated than they need to be. And so I saw what was happening to the women around me. So I do this work for my daughter, my granddaughters, my sisters, my friends, my team, all of us, everybody who's listening, because the message that we get is that Black women are resilient and, we're strong and we have to be all of these things. And what I want, my vision, is not to have these tragic stories of triumph over adversity. I want us to be women, and to get to be women without needing to be perfect, without being second guessed at work, without needing to know everything that our doctors and nurses and providers know just so that we can get good care, without having to work twice as hard as everyone else just to make sure that we're treated fairly. I do this work so that we, Black women, have the choices and can do what we really want to do, to be as healthy as possible and at peace, because there is nothing wrong with us. We are not broken.
I love that. I love that byline, our health is our power. But you're right. For so much of the narrative around Black women is strength and resilience. But that suggests that there's a need for that consistently. We're celebrating tonight. Offer my congratulations to all of you ladies for the work that you're doing, and the amazing staff and all the volunteers that are part of BWHI. 41 years is a long time, and I think people, they see the logo, they see the information, but they don't realize that this has been something that has consistently been changing the lives of Black women for over 41 years. So just so we can kind of understand a little bit about that, Linda, can you give us some of the milestones or things that you feel like need to be celebrated? When you think back over the years of what this organization has been able to do and the impact that it's had on the lives of Black women, can you talk about some of the things that you are extremely proud of?
Yeah, there is so much. I mean, first of all, we're the only national organization that does what we do. We're the only one. And Christal, for 41 years, we have been the only one. And we are among, frankly, the largest nonprofits in the US, if you can imagine that. And that's exactly where we should be. I think there should be more national organizations because, our health and wellness deserve that. But here we are. And so we step into that gap with research, with data, with policy, with programs, with information and useful strategies for Black women. And we've done so much that I'm proud of. And you'll hear from the team from a number of things, but I think I want to point out just a couple. We're all familiar with breast cancer statistics. We hear them all the time that Black women die 42% more from breast cancer as compared to white women. So a few years ago, the United States Preventive Services Task Force was recommending raising the age to start looking for breast cancer. So we know a couple of things. One, Black women get breast cancer 5 to 7 years younger than white women. So why would we wait to start looking for it? But also they talked a lot about how their recommendations were based in science, in research. And that's true. They had cited a number of studies that were done in Sweden and Canada. There were no Black women in those studies. And so one year, 2016, I spent that year talking about this and explaining that I too know the data. I was in 30 meetings that year, and in 29 of them, I was the only Black woman in the room, only Black person in the room. And fortunately, we got legislation passed that put a moratorium on raising the age of screening mammography. So that didn't happen. The USPSTF has since reversed itself and said, no, we should start screening at age 40. So they kept it at 40. But had they not done that, had we not been successful, another 1,300 Black women would have died every year from breast cancer. So I want our sisters to know that we're out there fighting for them every single day. And they also need to know, and most do, how important policy is. Every election cycle, we produce Black Women Vote so that Black women and other people know what's at stake with our health, what kinds of legislation and policy actually impacts our health, and what would happen if certain policies were passed or weren't passed. So if you go to BWHI.org, you can download your own copy of Black Women Vote to educate yourself on key policy issues for our health, which are so critically important this year. And so starting on the 15th in Georgia, when you can start voting early, or November 5th, if that's your choice, wherever you are, vote like your health depends on it. Read our voter's guide, educate yourself so you know when you walk into that ballot box exactly what's on the line.
Before we move on from that, we definitely want you all to visit the website and download that guide. I love what you said. Vote like your health matters, but it depends on it. Vote like your health depends on it. I have to ask. We know that there's been so much conversation around Project 2025, and so I just want to pose this question to the entire panel. From that document, can you talk about the framework? If what's in that document is what our government is going to be implementing, how do you see that affecting the health of Black women and where we go from here? We know that in so many areas when it comes to healthcare, we are at the bottom consistently. And so if this Project 2025 is pushed forward, I just want to hear your feedback on what that means for the health of Black women moving forward into 2025.
Well, I can start briefly because everyone on this call it will have a lot to say. I'll point out maybe one thing. So Medicaid right now, which is an insurance program, obviously for low-income women, would be turned into a block grant program. So a fixed amount of money would be given to states to cover patient care in those states. It will not be enough money, I guarantee you. And right now, over half of all babies, Black babies born in the US, are covered under Medicaid. So the Medicaid expansion, of course, will be rolled back in some states and certainly won't happen in other states. And Medicaid right now in every state except 4 covers a full year postpartum. That will be rolled back. So what we will see is an increase in maternal mortality and infant mortality. And obviously, we know what will happen with reproductive rights. And so we'll see Black and brown women plunged into higher rates of mortality and morbidity and poverty because they simply won't have the resources to take care of themselves or their families or make the best healthcare decisions for themselves, which is what happens when you lose reproductive freedom. All aspects of your life are impacted.
I will add that one of the things that is frightening about Project 2025 is just the level of control that they will have over, say, NIH funding for research. And we already know, as Linda was saying earlier, that Black women are underrepresented, way underrepresented in research. And they're talking about even controlling women's research as a whole more. And so it will be cut out, and we won't have the data to make the impact that we know that we need to have to focus on our health.
I think Linda and I are on the same page in terms of thinking about what does it mean for women's healthcare and women's reproductive healthcare, particularly, if you extract government influence on healthcare and insert more for-profit, more capitalism in healthcare. We already live in a nation where too many women live in maternity care deserts. And that's happening because the hospitals in those areas are closing their doors because they cannot make the bills meet, right? They're in the red. Now we go to a block grant system, or we go to a system that allows more profit to be extracted, and we get more maternity care deserts. The United States cannot afford to have our maternal mortality rate grow up for any reason. And Project 2025 is talking about removing investment from maternity care that we cannot afford to have removed. So I think I hate being doom and gloom, right? I like looking on the brighter side of things, but there does not seem to be a brighter side of Project 2025, unfortunately.
Yeah. So simply put, Project 2025 does not align with the freedoms we need to achieve the dignity and achieve our optimal health and wellness. We see that it's going to impact all of these areas. It's going to restrict us. It's going to impact the systems in which we already are trying to navigate and change so that we can have better outcomes, right? And we do know with the social determinants of health, it's about where you live, where you work, where you play, money you can make. All those things are important to our optimal wellness. And so, without reiterating everything that was already said, it just does not align with where we need to go, how we need to address those issues that already exist, how we need to fix those systems, create new systems, whatever we need to do. Project 2025 doesn't align with that.
And I'll close out by saying everyone left behind. Project 2025 means everyone left behind.
Well, again, vote like your health depends on it, and definitely visit the website for more information. Now, Dr. Sharon, you mentioned that we don't want to be doom and gloom, and we know that BWHI is all about being solutions oriented and creating opportunities for us to help our communities. And so, how can we, as a community, better support Black mothers during postpartum periods when complications and disparities in care often continue? How can we be advocates and offer solutions for them?
I think there are a couple of levels that we want to look at protecting Black women. And, hopefully there are some other folks listening, because if you follow what Black women need, your life will get better too. So while we are mentioning and focusing on Black women, what makes Black women's health better makes everybody's health better, right? So listen up, everybody. One is to look at overall general health and wellness, right? So your ability to be active, your ability to eat nutritious foods, your ability to eat fresh foods, right? So things that contribute to your overall health and wellness are going to help you be healthier during pregnancy and postpartum. Postpartum in particular, you want to make sure that woman is getting help and attention. And what do I mean by that? Because that seems a little bit obvious. Oftentimes in our culture, we have an idea that says, well, the baby's born now. But when the baby's born, that woman is still recovering, and also her body's still changing from having been pregnant. So we need to make sure that we're not just, okay, off to work, right? Back to school, and leave her alone with no one paying attention to her, paying attention to, is she more down than usual? Is she looking like she's not interested in the music she used to like, or the books she used to read, or all the cute things we bought for the baby? Someone else, because she's not going to be able to tell you that. She has the disease. Other people around her have got to be paying attention so that we identify those things. Similarly, some of the complications that can occur that really impact a woman's health and life, that can get her readmitted to the hospital, again, they require her family and her friends and her village, her girlfriends, to be saying, hey, you've been complaining of headaches lately, right? So she needs help and attention. And that's what we can do as a community to surround her with that village. It takes a village to raise a child, but it also takes a village to help keep that mom-baby unit healthy. We can all participate in that.
I like that, because we don't often talk about that. That's so important, because the baby is only going to be healthy if the mommy is healthy as well and is able to, provide for that child. And we were talking about definitely with some of the issues raised in Project 2025. And I know just, what we hear socially is every time there is some type of illness, Black women seem to be at the forefront of that. We are definitely known for our strength and resiliency, but we are often known also for having hypertension and having high numbers when it comes to obesity. And so I want to ask you, Michele, what obesity, we know, is something that consistently comes up when we're talking about Black women's health. But conversations often miss the nuances of how to support people living in larger bodies, and how are we able to really shift that narrative, because we understand that there is an issue, but we don't often talk about how did we get here, and how are we able to empower women and create an environment that fosters wellness rather than promotes that stigma.
Yeah. So I think there's a couple of things. I mean, statistically speaking, 40% of the population is living with overweight or obesity, period. Okay. 60% of Black women are living with obesity, according to the statistics. So I think that it speaks to a lot of things. And for someone who lives with the disease of obesity, and I'm always advocating for equitable access to obesity care, I think that in terms of changing the narrative is really understanding, one, that it's a disease, and that disease is not a dirty word. That simply empowers us to look at it from a standpoint of that we need appropriate interventions to deal with it, and that one size does not fit all. And so, and also looking at all of the environmental things that impact, or the social determinants of health that impact, like why is half the nation almost struggling with obesity? And then for Black women, 60% of us are considered overweight or obese. That's a problem. And so it's like, so what is contributing to that? And I know that I can say that when I look at our most vulnerable populations, a lot of it has to do with the fact that Dr. Sharon talks about, that we don't all have access to healthy foods. We live in food deserts, okay? We don't have access to the full spectrum of medical care and options. The medications is we're hearing about the medications, and listen, I've been privileged to be able to use these tools. However, my gripe is like, all right, well, it's not enough for me to be able to have privilege to get it. Other people who need to have these tools need to get it also. So if we're going to change the narrative, we're going to change it and look at it from a spectrum that says, all right, this is a disease. And so we wouldn't look at people funny when we're trying to treat them for cancer and be like, oh, we're not going to order that test, or we're not going to give you this medication. So it's the same thing. And I think being able to look at all of those things, being able to advocate, like your life depends on having the equal access to all of the things that can help you to lose weight, to get healthy. And it's not always just about the weight either. Oftentimes it is about just how do you improve your metabolic health? In my own personal journey, I've lost and kept off 85 pounds, but I still fall into the category of a Black woman who's still living with obesity. However, my metabolic health has improved greatly because of that. But also, like I said, I have had access to the things that are necessary to be able to have the health and wellness that you desire. But I want to see every sister in America be able to have access to those same things that I've had access to.
Christal, can I pipe in here for 1 sec? I know
Yeah,
this
why
is
don't you?
our program, but I just want to say something about this, the statistics that Michele talked about. 60% of Black women are overweight or obese. When we look at diseases, one of the things that we do in this country mistakenly is that we only categorize by race, right? And in doing so, we miss potential causes, potential correlates that are not related to race at all. So if we ask the next question, we see a difference by race. 60% of Black women or Black people are overweight or obese. And we say to ourselves, well, Black people are genetically the same as white people. So why would they have obesity and overweight more? So if we ask that question, then we might find out that it's related to levels of stress. It's related to a different access to nutrition, and related to environmental exposures. And then we can start solving problems again, like I said earlier, not just for Black people, but for everybody who's similarly situated, everyone who has similar access to nutrition, everyone who has the same environmental exposures is going to have improvements in their health and wellness because you asked that second question. So too often in this country, we find a difference based on race and we stop right there, to our detriment, to the detriment of the entire nation. We need to ask the next question after we see these differences.
I so agree, Sharon, because when I think about obesity and I think about the levels of stress, we're talking about the strong Black woman, and that stereotype, exists in some part for the reason that we are often carrying the burdens of our society because of the disparities that exist. And so our cortisol levels are influenced, our sleep is affected, our self-care is affected, our emotional eating is affected, and so depression that can come from, the level of stress that we are carrying comes out in one way or another, and it often comes out sideways. And so we really must look at stress as an indicator of health as well.
Well, Barbara, I was actually coming to you next because I was so excited to hear that we had a clinical psychologist participating in this panel and this discussion, because I don't think that we can speak about health in solely in terms of physicality. We also have to think of our mental health as well. And I think now we see things changing, and medicine is focusing on mind and the body as opposed to mind or the body. Why do you think the mind body connection is often overlooked when treating diseases? You just talked about obesity and some of the issues. Like, why are we not drawing the correlation to our mental health directly affecting our physical health?
I do think that when you talk to physicians or other providers, that there is an awareness that there is a mind body connection, but the way that we practice medicine, the way that we practice our healthcare, as well as our educational systems and the way that we're taught, we are taught in these kind of silos. And so I do think that it is getting better. There is an awareness, but when I look at, for instance, managed care and how we are practicing, you only have so much time to work with someone, and you're going to work with them in your expertise. And then, in terms of if you're needing to call another office, you have to find time for doing that. And managed care is a volume-based business, and it's unfortunate because I know I practiced psychology even before managed care existed, and it was different in terms of your ability to stay with clients and just focus on that, call the other providers. But again, this siloed way that we're operating in healthcare, and and again in our educational systems, not really having enough focus on the behavioral health care in medicine, not focusing enough on the physical aspects in psychology, et cetera. There's a lot to be improved. I will just say this finally, that there is more improvement, like the integration is now being held in medical practices, in primary care, where they're expecting behavioral care to be a part of the system. And the assessments are getting better and better, but it's still siloed.
Yeah,
What can we do as volunteers, as members of the community, to really kind of bridge that gap and start to view issues in our health and our mental, that health, physical and mental health as a collective, as opposed to individual issues? What can we do to start to change that narrative and even that way of thinking for ourselves?
I mean, some of it is structural. I mean, I think one of the things that Dr. Brown is bringing out, and she's talking about there being volume, right? So when things are volume based, people don't even have time. Like in the space of mental health, obesity, a lot of the providers are saying, when they do these surveys, well, why didn't you ask about obesity, or why didn't you ask about this? Well, I didn't have time. So if you are being dinged because you don't see enough patients in your 8 hour time, and then you've got to do the documentation and build that in, then there's going to be things that are going to be missed. So I think from an advocacy standpoint, we have to, one, call these things out, and then we have to be demanding better because we deserve better. And so I too I was in my clinical work back when we switched from regular care to what I call mismanaged care. And it all changed. It all became very, very different. And I think that we must continue to say how this is impacting us and demand for change. And that's not going to happen without policies changing, right? That's the foundation of everything. And also being willing to say when we are not getting adequate care when we go to our providers. And it's not that people want to be bad doctors, it's because they're put into a system that doesn't allow them to practice in the way that we were all trained to do no harm. So if it's like, do you want me to really see this person as an individual and do my work the way I was trained to do it? Or you just want me to make money? Because that's what it comes down to.
I do want to say that I'm just going to jump in for a second, that helping clients become their own best advocates is also a really good way to make sure. And there are some applications, some technology that is becoming more and more available so that the uh, client, the patient, can be the holder of their health care and take that to the appropriate doctor so that there is a greater awareness. So I do think there's an opportunity here as well, by educating the patient on getting their needs met holistically.
And if I can just say two more things on this topic. One is, if every person who's listening to us right now, call your health insurance company and tell them you want to get a mental health provider, because they should know that you feel like you want to take care of your mental health, and they should understand that you expect your healthcare dollars to cover your mental health. So that's number one. And number two, I want to emphasize something that was said earlier. Vote like your health depends on it. One of the candidates in this race wants healthcare and the federal government to be more profit driven, right? They want to invite for-profit companies into every sphere of healthcare. And the other one is not so much so, right? I'm not going to tell you which is which, but you need to educate yourself and figure out which one of these candidates on the top of the ticket, but look all the way down to your local level, which candidates are going to meet your healthcare needs the way that you think would optimize your health. So vote like your health depends on it.
That is the theme for tonight. Vote like your health depends on it. If you're just joining, we are having a conversation. We are not broken. Our health is our power. This is all, of course, powered by the Black Women's Health Imperative. And we're talking about things that are impacting our health. And a big part of that is the election that is coming up. We want to make sure that our listeners and our viewers and our organization and community is educated on the issues. And so we have to stay right there for a bit more. Dr. Zsanai, we know that the Black maternal health crisis has been a hot ticket item and a big piece of big conversational piece in conversations leading up to the presidential election. That it should be a conversation piece regardless, but we know at times like this, when people are pulled one way or the other, that the issues that are affecting our community that we need answers on become extremely important, or at least a huge talking point. So I want to talk about the impact of abortion bans on Black women's health specifically. Recently, we have seen the tragic outcomes like the death of Candy Miller due to the Georgia abortion ban. How do restrictive abortion laws disproportionately impact Black women's health, particularly in states like Georgia?
Yeah. So what happened to Candy? What happened to other Black women across this country in other states, not just Georgia, is a tragedy because it does not have to be like that. It was preventable. And when we look at the abortion bans, there are so many states that have restricted access to abortion care, which is reproductive health care, which is health care, period. And so when we see those restrictions, we are not giving women the healthcare services that they need to live their optimal lives. And so when we think about the abortion restrictions and the access that currently exists right now, people can't get the care that they need. We operate from a reproductive justice lens. And so we know that these abortion bans impact everybody, right? Not just folks that want to become pregnant who are pregnant, but they deserve to be able to determine what they want to do over the course of their pregnancy. And that should remain with that individual and their healthcare provider. What we saw in Georgia was unacceptable. It goes down to the basics. We're talking about our Black Women Vote Guide because that's so important to look at. We have physicians who are in Georgia who were scared to support a Black woman when they needed to, right? Because they were scared about their profession, their selves, and the criminalization that they feared would come to them because they could not understand or interpret what the law was, right, for Georgia about them providing emergency care to someone. I also just want to note for everybody that medication abortion has been proven to be safe and effective. So, there's a lot of rhetoric about what's going on there, but it is safe and it is effective and it's an effective form of health care. And if folks don't have the access to it, if they don't have the reproductive services that they need, should there be a complication, then we have a lot of work to do. I think this ties back into what's needed. The overturning of Roe, you'll hear people say Roe was never enough. That was the floor, right? And so we don't need any kind of federal protections that look similar to Roe. We need new protections because right now the battle is with the states. And we're seeing that. We're seeing a lot of states, people coming together to enshrine abortion rights, reproductive freedoms into their state constitutions, which we want to see more of, and then those, states who currently have access, right, to abortion, access and other reproductive health services, we can't rest on our laurels because we know that a lot of folks are traveling state to state to receive access. They're in fear of their lives of being criminalized. People are put, bounties on people's heads for, getting and trying to access services that they need that will ultimately save their lives. And if we continue to follow in this route, we'll continue to lose our Black mothers. We'll continue to lose that freedom that we need to be able to self-determine our lives. And so when I look at what's happening, I'm having these conversations with, young Black women through our My Sister's Keeper program, through our Positive Period program, and just talking to them and understanding. I do want to uplift my dissertation was about this, right? So I wanted to look at the impact of overturning Roe with the Dobbs decision and what that impact was a year later on Black women who are pursuing public health degrees. We're a part of the ecosystem of supporting folks. And what I found was, of the participants in my study, one of them had complications right? And was scared to let someone know that, let a physician know that she, needed support, right? And so there she was in pain and almost about to lose her life because she could not say, that she was having complications. She was almost septic. She almost lost her life. And that should not be the case for any Black woman, anybody with the uterus in the United States. That should not be the case. You should not be in fear of getting necessary health services. And so, what's happening, we see the fallout of it. We see how it's going to impact other health outcomes for folks. The abortion bans, just was here with it, because we're also seeing that some of those same states that have total abortion bans are also having not restrictions around contraception, but those are contraceptive deserts, right? Where they're not investing in contraceptive access. And we know that abortion is just one thing. They're coming for contraception. Having access to the full range of comprehensive sex education, reproductive health services, all of that is important for the conversation right now. And we can't just, look at what's happening with the abortion bans. We have to look at it overall of what that impact will actually have on folks. And when we have these abortion restrictions in place, we have to think about what's the aftermath of this. Are there social supports in place to support folks? Should they determine that they want to have a child? What are those social supports? Can they have assistance? The postpartum care to 12 months with Medicaid is amazing, right? But what about after? What about supporting that? So we have to look at both ends. Abortion is not just about, someone doesn't want to have a child. It's so much more than that. And we have to look at it in a larger context, because we are losing Black women because of not being able to get the healthcare services that they need.
We are losing Black women for sure, but we're also losing the doctors and other providers who
Yes.
do not want to be in this level of oppressive uh, government and business based practice. And so you have, and Sharon, you can speak more to this, Dr. Thompson, but physicians fleeing. We have tons of mental health people who are again going into self-pay practices rather than being available, to the masses because of the way that managed care is being done these days. But the political heart now uh, in the states that is driving the healthcare field is making doctors say, this is for the birds.
I want to take a comment. Jacqueline Rupel, who is a retired nurse practitioner, wants to make sure that all the people listening understand that the term abortion is a medical term used to complete a miscarriage, et cetera. It is not a term to rid someone of a fetus. So I just wanted to make sure we listed that comment. We also have a few questions. I know I have one more question I want to get out to Linda. I think, Zsanai, we could definitely talk about that issue for an entire hour itself. It's such a huge issue and such an important one. Really quickly, can you leave a resource or share with people where they can find more information on BWHI's website or another website that can give women information if they want to know more about what could potentially happen and what exactly the Roe being overturned, Roe v. Wade being overturned, what does that mean?
Certainly. We have developed a comprehensive voter guide, right? So we're talking about those issues. We also provided a checklist of what folks should look at when they're thinking about, supporting candidates and what they support. We also have information around where those bans are. We have maps and things like that. So I would say, please, take a look at our website to review that information that we have available.
And there you go. You can go again to download the voter's guide, bwhi.org/Black Women Vote. I'm going to go ahead and go to our audience. We have an amazing audience that has some questions for our panelists. And our first question that has come in is for Dr. Brown. It says, Dr. Brown mentions the education of healthcare providers and the industry being very siloed. When we think of specialized medicine, we see doctors too often fixing symptoms rather than the root problem. What do you all see as a solution for more holistic medicine and looking at the whole individual to better health outcomes for the long term?
So it's interesting. I'm giving a talk next week on holistic kind of assessment. And it is so important for us to look at both the micro as well as the macro factors that affect us. So the social determinants of health, the physical health, the mental health, the childhood history, all of it is so important to making a more comprehensive judgment about what is happening with this individual in front of me, and how can I best help them, and how can a team of people work with them, not just me. And so I do think that our assessments need to be much more comprehensive. And I do think that again, technology can have some usefulness here, so that uh, one person who the client sees can be more impactful, and by having a better idea of the comprehensive assessment. So I'll say that one thing, but I'll let other people speak, and I may come back.
Yeah, I'll add that I think that in terms of the holistic, um, from a healthcare provider standpoint, I think it's really important to not see your patients as one dimensional, right? It's like none of us are one dimensional. We're multidimensional. So when someone is sitting before you in your office, I don't care what your discipline is, I think that it is important to be committed to seeing, hearing, and honoring that person and their lived experience, and partnering with them to develop treatment plans that are specific to what it is that that person wants, as well as what they need in order to get to a better place of health for themselves. And I also will add that it is perfectly okay to fire your provider if they're not listening, if they're not willing to partner with you, because it should be a collaborative partner relationship to figure out what it is that's going to work best for you as the individual.
I think our continuing education, things that we all have to do as professionals, can help with the integration piece more as well, in terms of informing us about each other's fields, and so coming with more knowledge to help our clients.
And Christal, I would say, just to put what Michele said maybe in starker terms, you wouldn't take bad service from the cable repair person. Don't take it from your providers. We're often afraid to change. We're embarrassed. Don't be. Find, if it doesn't feel right to you, find another provider, because you owe it to yourself, and you will never regret making good decisions for your health.
I think the investment that we can make monetarily is also really important, so that we can drive dollars into creating opportunities for more healthcare providers to come into the field, and to incentivize them, because we need an army of people, especially since some people are leaving the field.
I give a presentation called Finding Dr. Right, where I talk about a lot of the things that folks have just mentioned here. And one of the ones that's important too is time. So oftentimes everybody's busy. The doctor's busy. They have a million patients coming after you, but also you're busy. You schedule 20 minutes for this appointment and you got to get out of here. But we have to remember that all our relationships take time. And so if you're building a therapeutic relationship with a provider, that's going to mean that everybody needs to slow down. The provider needs to, but also you need to slow down, so that you do communicate to your provider what's important to you, and they get to know you more than, oh, my toe hurts, or oh, I have a headache today, right? So we're building a therapeutic relationship, and that takes time in one visit, but it also may happen over several visits. So just understand that you're building a relationship that will serve you in the long run.
That actually is a great segue to our next question from the audience about the relationship between doctor and patient. Dr. Jennifer Daniels was criminalized for not meeting the quota for writing our Black community with prescriptions. How do we rebuild trust with the healthcare professionals? And I've heard that so many times myself, just, that there's a distrust and a disconnect a lot of times in the Black community with the doctors and with, especially when they're prescribing different medication. There's so many people that just don't trust that system. And quite honestly, there are reasons that a lot of our community probably does have a distrust with that system. So who would want to speak to how do we rebuild that and with open conversation and action items so that we can start to actually trust when our doctor gives us a prescription?
I'll start. I think one of the things that Dr. Sharon said is about building relationships. And I think that if you can build a relationship with your provider in a way that they see and they hear you, and they're coming with what I call compassionate care, I think that that helps to build trust and it opens the lines of communication. And I can say that in my own lived experience, is that that was a big game changer for me on my weight health journey, is that I had a provider who saw me, who listened to me, who believed me, and who helped me to navigate even my own mindset and my own implicit biases about various options, right? So I think that the key is being able to build compassionate relationships with your providers. And back to what Linda said, is that if you are with a provider and they do not seem to be responding in that way, you need to find another provider. And it's okay. I mean, business is business, as my parents said. And so the business of my health is top priority. And so if you are not honoring me and you're not listening to me and you're not willing to work with me and meet me where I'm at, then you're not the right provider for me.
It's interesting. In mental health, though, building the therapeutic alliance is the first thing you're taught as a provider that you have to do. I don't think it's as well taught in some other professions. And I think it is absolutely necessary, but it is critical in that therapeutic relationship of psychotherapy.
I think when I was trained, that doctors are developing a therapeutic relationship, and that may have changed. Right, I'm a little seasoned, but I do think that Michele's point is absolutely. I preach this all the time. You want to feel cared for in your healthcare experiences. If you're in a healthcare experience and you don't feel cared for, you might have to do that for now, but you don't have to do it forever. So I am an advocate too of shopping around when you can to make sure that where you land is in a place where you have that therapeutic alliance that Barbara just mentioned, or the therapeutic relationship I was taught that we are striving for.
It's very important. So, Linda, I know that you are a member of the White House Advisory Board for Women's Research. Yesterday, the news broke that the Department of Defense has new commitments to advance women's health research. How do you feel that will impact not only women in the military, but also broader effects to address health disparities, particularly for Black women and women of color?
Well, Crystal, I was so excited about that announcement. The Defense Department has done this before. There, of course, is the ARPA-H program, which was a $100 million commitment to research. You talked about the initiative on women's health research. It is finally happening. We are finally paying attention to research in women's health, women as researchers, but understanding that women are not female versions of men. I mean, literally, it's only just 25 years ago that we had to have sex differences in mice because it was all male before that. So this is really exciting. And women veterans have a host of issues and concerns that women who have not served in the military don't have. And so some of the issues that we talk about are affect them even disproportionately and certainly differently because of their service. So I'm excited because we can take what we learn from research among this population and apply it to the broader population. And, I'll just say it again. I know it's been said before, but if we look at Black women in the military and their experiences, they are very unique. and often very challenging. So if we can fix it for Black women in the military, we can fix it for Black women, and we fix it for Black women as a whole, we fix it for everyone.
That is a great note to end this part of the conversation. Again, if you have just tuned in, we are having a conversation basically celebrating 41 years with the Black Women's Health Imperative. Our conversation tonight is titled "We Are Not Broken, Our Health is Our Power." And that conversation has reflected just that. I want to ask each of you as we get ready to wrap, because these conversations, every time I'm in a conversation with Black Women's Health Imperative, I feel like we could continue going because there are so many issues that we face as Black women and so many issues that Black women need more information on, right? There's so many things that there's a narrative that is half of what, or even a third of the entire story. And there's so much education that needs to happen. But just taking from and pulling from tonight's conversation, I would love to hear last thoughts from each of you. I will start with Michele on just the overall conversation and where we are as a nation right now, specifically in terms of Black women's healthcare.
Yeah, I think that I echo what all of my colleagues here echo is that as you are considering our political climate, that you must vote as though your life depends upon it because it does. And so educate yourself, utilize the tools to know who your candidates are. And it's not just about the top of the ticket. That's the most critical and the most pressing right now. But what we forget about is whenever the smaller elections are coming up, that's what empowers the executive branch. So, as you are considering your own self-interest, make a commitment to yourself that you'll vote toward your own self-interest in a good way. And not only that, I'm going to take it another level, is that the interest of all of the folks who are impacted by some of the policies that we've been talking about that will impact us all. They will impact us all. So educate yourself and vote like your health depends on it because it does.
Dr. Zsanai?
I would just say thank you to everyone and my colleagues who mentioned and uplifted all the things. I just wanted to say to, young folks, right? I'm the resident young person. I still hold that hat. It's up to us to really get active and educate ourselves and share that knowledge with the rest. Just piggybacking off of the piece about the workforce and building trust. We're the ones that will be leading the organizations. We're the ones that will be training in medical schools and things like that. And so it's important for all of us to see the connection and why we need to revamp the systems that we are navigating. It's so much on the line for us right now that will impact our health, our wellness, our life expectancy. And so we must show up. We must continue to uplift everyone in this work. As Michele said, voting down ballot is so important. There's a lot of action happening at the state and local level. Get involved, figure out what's needed. Look at our Black Women's Vote guide. It talks about those things that are on the ballot in your state that would be relevant to our values here at the Black Women's Health Imperative. So it's so important to use the resources that exist, get involved with all of our offerings as an organization. I think something that I'm super excited about is that when I see folks that have been a part of our programming, especially for young folks, and to see them out in the field and going into their careers and them becoming colleagues is so important because I know it's more folks in this work that believe in the Black Women's Health movement. So thank you.
But we got to say to you, because you were one of those students impacted. So before we move on, that I'll be remiss not to mention that you started with Black Women's Health Imperative as an intern and have gone on to acquire your PhD and now are senior director and such an amazing, impactful advocate for the organization. But you're a beautiful example of what happens when young Black women have opportunities to learn and to feel like they can be a part of something and to go ahead and hold that torch for us. So I heard all the great things you were saying, but we had to make sure that our viewers understand that you're speaking from in real time
Yes.
for what you're actually doing. Dr. Sharon, what about you? What were lasting words specifically when it comes to reproduction and being, all the issues that come along that women come into your office with, from having a baby to breast cancer to going through the time, that special time that
I want
comes
to say
upon
first,
us.
thanks everyone for joining us this evening. And I do want to say that even is in spite of everything we talked about with systems and policies, etc. A big part of our health is in the title we have here is our power. We have the power to control how we move our bodies and what we eat and what we choose. We don't have 100% power, but a lot of it is on our hands. And I implore each and every one of you to utilize the power that you have to make the decisions to optimize your health on a daily basis. As a clinician, what I add to your health is about 10% of your health. But what you can do is 90%: how you eat, how you exercise, who you vote for, right? We all mentioned that your political and civic engagement is a part of protecting your health, because those choices determine the policies that you have to adhere to, the policies that your clinicians have to adhere to, right? Doctors are people who have to follow the law too. So if you see laws and policies out there that are not optimizing your health and wellness, you have the power. And I encourage you all to use that power to optimize and maximize your health.
Barbara?
Yes. I wanted to focus on just to acknowledge that Black women are survivors, Black women are resilient, but we don't need to do what I call the wheelbarrow theory of when people come into healthcare, where they're just going on with their lives and a brick comes in and another brick and another bad experience and another this and another that until it tips over. You don't have to get healthcare, you don't have to wait until then. It's really important for you to understand that oftentimes you're having normal experiences to abnormal situations, and that it's really okay to talk about it. You don't have to carry the trope of the strong Black woman. You can be a strong Black woman and be vulnerable and ask for help. And that is important to also say that there are people who care, and the healthcare providers who have stuck with it really want to be there for you. And also in all the female groups that you can find, as well as ones in your community, you know, join together to support one another. So
Speaking of Black women asking for help, I'm going to ask Linda, our president, to not only share her final thoughts, but also if you've enjoyed this conversation, if you want to hear more, if you have been impacted by the work and the programs that Black Women's Health Imperative has done over the last 41 years, we need your donation. And so I'm going to ask Linda to let people know how they can become involved, how they can donate, how they can get back, how they can become active with Black Women's Health Imperative.
Thank you, Christal. I echo everything that my colleagues, my team has said. This is an incredible privilege, and to be able to lead the only national organization with this focus is also a great responsibility. But Barbara said it. She was talking about providers caring, but we care. We do this work every single day for all of you, for all of us, because we are the women that we're serving as well. Mm-hmm. And so the partnerships that we form are invaluable to helping Black women understand what choices they have, what choices they can make, what's available for them when whether they're dealing with a chronic disease or they're having a maternal health issue, a mental health issue, that they know that there's a place they can come to for research, for information, for programs, for policy work. We do this because we have people who believe in Black women, who understand that Black women are worthy because they did one thing today. They woke up. That's all that was necessary. And so your help and your partnership is how we are able to do this. Your support is how we are able to do this. If you go to bwhi.org/donate, please support us. We can only do this with resources to bring to our investments. Since I've been on board, we have invested over $25 million in community work, in bringing programs and services to Black women and their families. We can only do this with your help and your support. I will echo what everyone said. Voting is critical, and especially vote in your states. Know the issues in your states. Download Black Women Vote so you can see what's at stake at the state level, as Zsanai mentioned. This issue of states is important because some of you will remember back in the 70s, Richard Nixon started the states' rights movement, and the things that we see now, 50 years later, are playing out. These ideas, these strategies, these restrictions and limitations were envisioned 50 years ago. So if we don't vote, we may see these come to a reality, which then prevents us from making the best decisions or even the basic decisions about our health. We may see things come to pass that prevent the Black Women's Health Imperative from doing its work because funding for us could be limited. So please read Black Women Vote. Please support us. Make a donation in any amount. Any amount helps us move this work forward. And just remember that the resources that we get go into Black women's programs, to policies, to research, into communities. And no one can talk about the kinds of successes that we have. And I'll just mention one more as I close. Michele is our leading advocate for women who are living with obesity. We have a program that has been funded by the Centers for Disease Control for now 12 years. It started before I joined, but it is CDC's top performing program for diabetes prevention, chronic disease prevention, and the prevention of obesity-related conditions. Imagine that we've got the best performing program, and all we need to do is take it to as many women as possible. So if you care, if you are touched by anyone who is living with obesity, who is caring for someone living with obesity or diabetes or hypertension or heart disease, any of these kinds of conditions, support the Black Women's Health Imperative, because we have found the way to help women prevent diabetes, to manage their diabetes, to prevent chronic disease, and to deal with the psychosocial issues that come with how we have to live in this country and the kinds of choices that we can make. Support us. Thank you for listening. And we so appreciate I appreciate all that you all do, my team, my board members, but also what Black women do every single day. Thank you.
Absolutely. Well, we will of course want to thank our audience and those that have are out, hopefully tweeting and promoting this and that sent in questions. But of course, I want to thank the panel for not just for the hour and 10 minutes that you've been with us tonight, but for the work that you continue to do with Black Women's Health Imperative. Thank you, Michele. Thank you, Zsanai. Thank you, Barbara. Thank you, Sharon. And thank you to our president, Linda, for all that you all continue to do. Tonight's conversation, obviously, there's a consistent theme, and that is to vote like your health depends on it. And I also want to take another quote from tonight's conversation to remind us as we wrap this conversation on our health being our power. The business of your health should be your top priority. And as you heard from Dr. Sharon, the business of your health, you have power of over 90% of that. And so we can make changes, we can work together. You have a community right here that is willing and open and wants to help. We care about each other, we care about ourselves. And tonight's conversation and the entire celebration this week of 41 years of helping Black women achieve health awareness and a healthier lifestyle is all here with the Black Women's Health Imperative. My name is Christal Jordan. Again, I'm honored to have hosted tonight's conversation. Make sure that when you finish watching this broadcast, you go over and first of all, follow Black Women's Health Imperative on all social media platforms. Make sure you visit the website, donate, get involved, be a part of this struggle. It's all about us. It's all about us. Thank you all so much for watching tonight, and we look forward to seeing you next time.
Thank you.
Thank you.